testosterone decline? This is another hot topic. You talked about it at the start of this conversation. Is it true that male testosterone is declining, and how much has it declined by?
Yeah. So again, study from this NHANES, this CDC, measuring men every year for the last several decades. If there's data that shows that testosterone levels have gone down over time. People have also looked at other cohorts of men, from the 2000s, the 90s, 80s, and there's just a progressive decline in average testosterone levels over that amount of time. So the amounts kind of vary 50 to 100 points, but generally these are meaningful, measurable amounts. In addition to sort of these kind of cohort changes, where if you kind of look at the average 40-year-old now versus 10 years ago, our testosterone levels change too. So I would say that I usually tell men after the age of 20, your testosterone is going to go down maybe about a percentage point every year. So as we get older, testosterone does go down. And there's things, again, that can affect that trajectory. Men that get more obese, that also affects testosterone level. A portion of all of our testosterone is converted to estrogen. A lot of that conversion happens in, adipose tissue or fatty tissue. So the more kind of extra tissue there is in the body, the more that conversion will happen. And so your, effective testosterone levels will be lower.
What about movement and exercise? Does that have an impact on our testosterone levels in a significant way?
Yeah. I mean, I think that, the more walking you do, the more active you are. We've looked at that as well. Step count is directly correlated to testosterone. And you don't have to take 20,000 steps a day, 4,000, 8,000 steps a day, just kind of walking around, sort of reasonable amounts. It can make a big difference. And I think that, activity is important. It probably also helps stave off obesity a little bit as well as another mechanism.
Okay, so I'm a Manchester United fan right now, and we're losing a lot.
I thought you guys had turned it around.
Yeah, I thought so too, until last week. Okay, so if you're supporting a team that is losing, your testosterone levels are likely going to be lower.
Well, I think this is sort of an acute thing. Maybe we could do that experiment, right?
Where does that research come from, that if your team wins, your testosterone increases?
I don't remember. That study's pretty old. I think that even predated my training, but I do remember reading that. I think that was one of the articles that get picked up by the newspaper.
Okay, of course. Why does testosterone matter?
Well, I think testosterone is very important for, a lot of things. I think it's important for our quality of life. So energy level, sex drive, mood, sleep, concentration, all those things are very important. When testosterone gets very low, it also has a lot of health implications. So muscle health, bone health, heart health. So we do want to keep our levels in a normal range because I think it kind of helps us with our function and our life and happiness.
How does it impact our sort of muscles and bones? I don't really understand what testosterone is doing. I kind of think of it as the chemical that kind of makes you a man. I know women have testosterone too, but I just think of it as the chemical that makes my beard grow and my voice deep.
Yeah, well, that's what it's doing, but it's anabolic. It does help kind of grow. It helps with bone turnover and kind of keeps sort of, the strength of the bone. So men that have very low testosterone levels have, frailer bones, higher risks of osteopenia, osteoporosis. So, I think it helps with muscle growth, bone turnover, bone strength. So I think all those things are important. They usually don't get into those problems unless men are very, very low. I would say that, I don't know you, but the average testosterone levels are probably 300 to 900. I would guess probably on the higher end of that. But when men are low, probably less than 200, 100, that's where we start to worry more about, bone health, muscle health. And so I think that there is some wiggle, but when you get kind of lower than sort of the normal ranges, kind of the 300 range, that's when some men do develop, some of the symptoms of lower energy levels, sex drive problems, things like that.
So low testosterone typically means lower sex drive?
It can. It's one of the common symptoms that we see with that.
Does that mean that if I just take loads of testosterone, my sex drive is going to go back up?
Over the last probably 10 to 20 years, the number of prescriptions of testosterone written in the US have kind of gone up almost at an exponential rate. And because people did think of it sort of as a kind of an anti-aging kind of rejuvenation therapy. And so there was hope that it would help people. But if you look at some of the randomized trials, if a man has a normal testosterone level and you give him testosterone, it may not help him that much. Even men that have kind of a lowish testosterone, like we talked about, sort of this 300 cut point. So I've had plenty of patients, testosterone of 250, let's say. So we talk about risks and benefits of being on testosterone. We'll try them on it. And, a lot of men do feel better, but not everybody. Some men say, I don't feel any, doc, I don't feel any different. Even though we get his levels, from 250 to 500, And so then it's probably not worth, to be on a medicine every day if it's not helping you. I'm not worried about his bone health. We'll check some other measures to make sure that's okay. So then it's not, again, when you look at risks and benefits, it's probably not worth it. But there are certainly some men who do see improvement.
So is testosterone hurting some people, their testosterone treatments? Does it actually have an adverse effect if you take it basically when you don't need to?
I mean, even when you do need to, I think it could sometimes cause issues. Yeah, there's certainly side effects to testosterone. One of the big things that I see in my practice is how testosterone impacts sperm production. It actually was tested as a contraceptive by the World Health Organization because it does lower sperm counts in most men. I would say 90% of men. Now, it doesn't do 100%, so it's not that great of the contraceptive yet. They're kind of working on some other ways to tweak it. But I have plenty of patients that come in. Some of them suspect that testosterone is the issue. Some don't know. I remember one couple in particular, they came in as a couple together. We measured his sperm count. It was 0. We started talking about risk factors and he was on testosterone. And I said, well, the best thing to do would be to stop testosterone. And for his work, we'll tell you what he did, but for his work, he really couldn't stop it. So there's some other medicines we were able to add while he continued the testosterone. And then they ended up with triplets shortly thereafter. So I think that, men need to be aware of it because that's, certainly one of the big risk factors, at least of reproductive age men, is this risk to fertility.
So it can impact my sperm count negatively.
Mm-hmm.
I saw a quote from you that said, if we take 100 of my infertile patients that I see in the clinic, at least 5 of those men will be infertile because they're on testosterone therapy. 1 in 20 infertile men are that way because of testosterone as it relates to infertility. One of the things that I've always worried about is if I take testosterone, then my hair would fall out.
Yeah. So that can definitely happen. So, hair loss, breast growth, acne, those can all occur. I would say those are things that we can monitor. So, one thing I always tell men is that we're not trying to get them to superhuman, right? We're just trying to get you to normal. So I think if we monitor it closely, most men, will do okay. Again, there's some other therapies that we can do for men that have side effects, from those things. It can also affect the thickness of the blood, something called the hematocrit, where we count the number of red blood cells in the body. It can increase that number. So if it gets too high, that can be an issue. So that's another number that we follow. There used to be a concern about higher rates of heart attack and stroke with testosterone. So there were some studies done, about maybe 10 years ago that suggested that. But a really large trial just came out with about 5,200 men. Half of them randomized to testosterone, half not. And there was actually no difference in the risk of cardiovascular disease. So I think that's something that we can probably put to bed. The other thing that men worried about is increase of risk of prostate problems, prostate cancer, prostate growth. And, that same trial also showed that from a prostate standpoint, probably not a lot of risk as well.
Do you have many men coming to you to talk to you about hair loss and balding?
Some men do. I think one of the ways that men talk to me about it is one of the common medications for that is finasteride,
right?
Or, sold under the trade name Propecia. And so they want to understand some of the risks of that. And so, when that medicine was approved for hair loss, they, again, because people are going to take it are usually in their reproductive age, they did randomized placebo-controlled trials to look at semen quality. And it turns out that it didn't meaningfully impact things. Maybe it went down a little, but not a lot. But in sort of post, analyses of some of this and now seeing lots of patients coming in, we do see men that are on finasteride. Some of them are more susceptible. And so one of the interesting things about trials is there's, kind of inclusion and exclusion criteria, right? Not everybody can be in it. And so if men had sperm counts that were too low, they weren't invited to be in these trials. So for men that, don't have as much reserve as others, I think they may be more susceptible. So that's one of the risk factors of finasteride. The other thing in addition to reproductive health is sexual health that I deal with a lot. And there's also a concern that finasteride impacts sexual function in men too. So, we have these discussions. I've had some men that come in after having been on finasteride and have, different issues with sexual desire, low libido, or erectile dysfunction. And so then we, work through an algorithm to try and improve that as well.
This is one of the things I think about a lot because I don't want to have a receding hairline, and I also don't want to have a hair operation or anything like that. But when I hear about some of these testosterone replacement therapies and such, my big concern is that if I take testosterone, maybe not now because I'm, probably don't need it right now, but maybe when I'm a little bit older, which is when I assume one would start taking it, maybe when I'm about 50-ish.
On average, but there are younger men that are on it as well.
For what reason? just because they're low on what's the sort of symptoms that have caused them to take it?
Well, I think there's, with all things, there's a bell-shaped curve. So some men are a little bit lower. Some have genetic conditions. There are some more nefarious testosterone prescribers. So even though men have a normal level, they're offered testosterone to kind of get in these kind of testosterone clinics. And some men, if kind of look at data, maybe 10 to 20% of, high school athletes have experimented with testosterone. And if you stay on that too long, it can really shut down your own axis. So if you take exogenous testosterone, so like testosterone injections or gels, your body stops making it. And the longer you're on it, the less likely your body's able to sort of restart. And so for some of these men, poor choices or, whatever, they've been on testosterone for a while and they can't ever stop.
I don't know if you've ever had any experience in it, because I know you focus predominantly on male health, but I've had a long conversation about contraceptive pills with my partner, because she said this publicly before, that she was on a contraceptive pill for a long time, and everyone's relationship with contraception is different, but after taking it for 7 or 8 years, she came off it and her period didn't occur. So she really struggled with that for a while previously. And it made me really, it illuminated the fact that when we start messing with the chemical balances of our body using pills and injections and other things, we could do pretty long-term and or permanent damage to ourselves. And there's no real such thing as a free lunch, is there, in biology and chemistry?
Yeah, I think that's what it comes down to. I think a lot of people have said that if they tried to get the pill approved now, it would be a much different process and unlikely to succeed for those kind of reasons.
If I have low testosterone, and I come to see you, what is the typical way of getting a testosterone replacement therapy? Is it a pill? Is it an injection that I have to take? I know that it's quadrupled according to the data in the US since the 2000s, which is staggering. But how are people taking testosterone?
So there's lots of different ways that it can be taken. I think one thing, again, we talk about all the risks. So fertility would certainly be a big one. So if you come in your 30s, I'd ask you about your reproductive intent. So if you have a low testosterone and you're interested in having 4 kids, I wouldn't start you on testosterone directly. There's some off-label things, so medicines that we kind of repurpose to help increase your body's own testosterone that we would start with. But assuming that, let's say you're in your 60s, you're not interested in fertility, then, there's gels or patches that you put on every day, testosterone gel or patch, because that can work well. Probably 10 to 20% of men don't absorb testosterone that well through the skin. The other thing to be aware of is that there's a risk of like transference, like to your partner or to anybody that kind of touches your skin. So if you have young kids, just to sort of be aware of. But as long as, you put it on, let it dry, put clothes on over it, it's not a big risk. Again, and also have to be, I guess, mindful of laundry as well. So, gels, patches are one. There's injections that you can do every usually 1 to 3 weeks on average. There's testosterone pellets. So these are pellets that have testosterone that are kind of slow release. So they're just injected. We kind of implant them under the skin, usually in the hip area, and those last probably 3 to 6 months. There's longer acting injections. So those are very common in Europe. They're kind of gaining steam in the US, but those are injections that last probably 10 weeks or so. And then there's a new oral therapy. So there's an oral form of testosterone that's available as well.